name is Laura Wheeler. I am in Galen College of Nursing and COM 2100, and I'm going to talk to you about the importance of learning CPR. CPR, 3 of the most important letters placed together that one can learn about in their lifetime. 3 letters that could save a life after learning their value and what they stand for. So, what do the 3 letters mean? Cardiopulmonary resuscitation is what CPR stands for, and by definition of the American Heart Association, CPR is an emergency, life-saving procedure performed when the heart stops beating. Immediate CPR can double or triple chances of survival after cardiac arrest. Being in the medical field, it is a requirement for obvious reasons to learn and know every in and out of CPR, but what if you are not in the medical field and an individual goes into cardiac arrest and no one around has any medical training? What would happen to that individual without any help? Well, the answer is that patient would probably lose their life, whereas with some medical training on CPR, that life could have been saved. CPR training is so important, it can save your life. It can save your children's lives, your parents' lives, or even a stranger's life. There are so many ways that one can get training on CPR, and now you're probably wondering what CPR consists of. According to American Red Cross, there are many steps not only during CPR, but beforehand that are just as important. Step 1, check the scene and the person. Make sure the scene is safe, and then tap the person on the shoulder and ask them if they are okay to ensure the person needs help. Step 2, call 911 for assistance. Step 3, open the airway. Step 4, check for breathing. Listen carefully for no longer than 10 seconds. If they are not breathing, begin CPR. In my opinion, these steps are so extremely important to follow in order and quickly to ensure that the person in danger of their life is getting the quickest and most efficient care that they need. It's very important to ask the individual first and then move fast so they can get oxygen quickly. The next steps, according to American Red Cross, are as followed. Step 1, push hard and push fast. Place your hands on top of each other in the middle of the chest. Use your body weight to help you administer compressions that are at least 2 inches deep and delivered at a rate of at least 100 compressions per minute. Step 2, deliver rescue breaths. With one person's head tilted back slightly and the chin lifted, pinch the nose shut and place your mouth over the person's mouth to make a complete seal. Deliver 2 rescue breaths and then continue compressions. Step 3, continue CPR steps. Keep performing cycles of chest compressions and breathing until the person exhibits signs of life, or an AED or trained medical responder arrives. Working in the medical field as an RN in the emergency department, I provide care to patients almost every shift to come to our ER in cardiac arrest. Last week, I had a patient who changed my life forever. He was an older man who had a history of congestive heart failure. He had been to our ER multiple times in the past, ran by EMS. This time, he came in at cardiac arrest. EMS stated that the call came in from a family member who witnessed the patient collapse on the ground walking outside to his car, and the family immediately started chest compressions with rescue breathing. EMS took over the patient and came to us very quickly, still continuing CPR. After 10 minutes of being in our care, the patient had a heartbeat again, and his life was saved. His vitals were almost perfect, though we were still breathing for him at the time. He had a heartbeat. He had a rhythm that was still providing him life. And the reason why his heart was still beating is because his family member saved his life by learning and understanding how to properly administer CPR. While working in this field, there are not many times where I've been able to see a patient come back from cardiac arrest, and majority of the time it's simply because no one around was trained at the time on how to administer CPR. His family member saved his life, and I don't know if he would still be here today if they didn't provide the care for him that they did. Having to practice CPR will come at any random time, and one would never know when they would have to perform it. According to AED, CPR classes will equip you with the tools and the confidence you need to transform yourself from the role of a bystander to a lifesaver. CPR certification will give you the necessary training to make the right decisions in an event of a cardiac emergency. There are a multitude of places and instructors who hold classes to train CPR on individuals. All you have to do is Google CPR classes in your area, and a dozen will pop up with different days and times. These classes are fun, very hands-on, and interactive. It is also a very supportive environment where every individual should feel confident and comfortable to ask questions, knowing that everyone is learning in order to possibly save a life one day. The amount of cardiac arrest in the United States of America is extremely high. In fact, according to the American Academy of CPR and First Aid, in America alone, sudden cardiac arrest results in the death of more than 900 adults. Out of 550,000 people who have coronary artery disease, 335,000 die each year due to complications from the condition or lack of proper treatment or early detection in America. With the fact that it is inevitable to see individuals with cardiac issues, it's so extremely important to gain the knowledge of how to possibly save a life. I know from personal experience. Watching that patient's cardiac rhythm turn from asystole to sinus rhythm, it absolutely changed my life forever. When we spoke to the family, I know for a fact that it changed their lives forever as well. They had just saved their loved one. Wouldn't you want to save yours? And right here, I have a picture of what your CPR certification looks like after you take your classes and you learn how to practice CPR safely. And